Okay, we're continuing with the hidden history of nutrition, health, and science by me, P. Rogers. We're doing a section on epidemiology. This is part 2, Dennis Burkitt. Dennis Burkitt was an Irish Christian missionary surgeon trained in Ireland and in England. Then he went to Africa and he figured out the pattern of transmission and inheritance for Burkitt's lymphoma. And then he got in charge of epidemiology for the continent and studying like over 1,000 hospitals and working with a couple other doctors. He put together his theory of abdominal pressure syndrome. Basically, he noted that people eating plant-based diet, like most of the people in Africa, they did not get the common abdominal diseases that he saw all the time in England and in Ireland. In particular, the fiber adds water bulk to the stool, makes it soft. When a person defecates, it's like a cow patty. They defecate several times a day, a relatively large amount of stool, versus the person eating where the fibers are removed, like the white bread, the jam, processed food, and oils. They're constipated. They have fewer stools per day. It's like goat pellets. And when you have a normal bowel movement of wet stool, bulky stool, it stretches the rectum, and that causes a reflex contraction, so defecation becomes effortless. Versus when you have little goat pellets down there because the stool's all dried out, then what happens is it doesn't stretch the rectal wall, so you don't get that reflex contraction, such that the person strains their abdominal muscles. That's called Valsalva maneuver. And that pressure of attempting to defecate is transmitted back into the abdomen, into the stomach. Stomach pops up into the chest. That's hiatal hernia. Causes relaxation of the lower esophageal sphincter, causes gastroesophageal reflux of gastric acid into the esophagus, esophagitis, heartburn pain. That can lead down the road after a couple of decades to esophageal cancer. Back pressure into the sigmoid colon, outpouching of the muscular wall, diverticulosis. Those can pop eventually, diverticulitis, abdominal pain, acute abdomen. Every major hospital in the West has at least one admit every week for diverticulitis. In addition, the stool's dried out on the right side of the colon, so it's hard, and you form little stool balls, fecalifs, like a rock, and they'll obstruct the appendix, which hangs down. So meat eaters, processed food eaters, people who don't eat plants, thus lacking in fiber, they get a lot more appendicitis. Okay, the back pressure of Valsalva transmitted into the leg, varicose veins, transmitted into the scrotum, varicocele, can cause infertility, transmitted into the rectum, hemorrhoids. Okay, it also increases the incidence of inguinal hernia, periumbilical hernia. That's abdominal pressure syndrome. Dennis Burkitt figured that all out. Pretty useful stuff. Most conventional doctors don't know that. I talk to them all the time, and even surgeons of the abdomen don't know that. And it's pretty basic. It's just common sense. Your stool is a little bit like the so-called camel's hump, even though I know that's not as obvious as it sounds and not as simple as it sounds. The point being is your body hangs onto your stool until you're ready to eat another meal or drink some water, because it can keep on resorbing water from it to maintain your hydration. That's part of what it does. Okay, other doctors who helped him were Dr. Peter Cleve in Utrall and Alec Walker. Okay, he was kind of a crazy guy, Burkitt. He went around measuring people's stool size. Okay, the population of people in Africa where he was working, they were eating mostly yams, which are like sweet potatoes and brown rice. They had a much faster intestinal transit rate, bigger stools. Okay, and they also didn't get coronary artery disease. They didn't get gallstones. Okay. Here's a couple quotes of Dennis Burkitt. It's better to build a fence at the top of a cliff than to park an ambulance at the bottom, meaning prevent disease. Prevention can eliminate disease, but early diagnosis and good treatment can only rarely eliminate disease. Our bodies are adapted to a Stone Age diet of roots and vegetables. The only way to reduce disease is to go backward to the diets and lifestyles of our ancestors. In 20 years with a vegetarian population, I only had to remove one gallstone. The citizens of countries that don't get bowel cancer, they also don't get polyps. The thinking that doctors and hospitals are needed to keep a society healthy is just plain rubbish. So what he's basically saying is diet's more important than anything else. Okay, just a little bit more. In Belgium, Dr. Caldwell Esselstyn, by the way, has the best results of anybody in the world for treatment of coronary heart disease with a low-fat vegan diet, no oil. William Castellia, the Framingham study, noted that in World War II, when people in Belgium were conquered by the Germans, they took away their meat and their cheese, and then coronary artery disease regressed, even though they were stressed out. So diet was more important than psychological stress. Here's some quotes about China. Dr. McDougall. In China, when they were eating 90% of their calories from white rice, they didn't have any coronary artery disease. 1 billion out of 1 billion of them were thin. Okay, here's a quote from T. Colin Campbell from his book, The China Study. In China in the 1970s, when they were eating primarily a plant-based diet, some entire populations had an average total cholesterol of 90. Okay, I'll do one more, Esselstyn. I began reading a great deal of medical literature with an emphasis on epidemiology, and there was a beautiful simplicity to the evidence. You look at a map of the world, and almost all the chronic ailments like coronary artery disease were crowded into Western countries. And then plant-based eating countries, they didn't get those diseases. He said patients must stick to the plant diet very strictly. Moderation kills. All oil, including monounsaturated olive oil, is bad for arterial endothelium. No oil, not one drop. Coronary artery disease is a foodborne illness that need never exist or progress. No other diet provides anywhere near this level of prevention for coronary artery disease. Yeah, by the way, they did an optimized version of the Mediterranean diet in the Lyon study, and the Esselstyn diet had more than 30 times better protection of coronary artery disease. That's why when you hear people talking about omega-6, olive oil, and all this other stuff, the high-fat phonies, I call them, nuts and seeds, they're full of crap, because the optimized version of Mediterranean, not even regular Mediterranean, was 30 times less effective than the Esselstyn diet. So don't fall for that nonsense. William Cliff Roberts, that great cardiac pathologist, he said, "We are herbivores." Caldwell Esselstyn, 3/4 of the humans on this planet, based on epidemiology, do not have heart disease. This fact is strongly associated with diet. William Clifford Roberts, the cardiac pathologist, again, he says, the most important thing and pretty much the only thing that matters is to keep your total cholesterol below 150. Now that statement is nice, but it's a little bit of an oversimplification. You know, atherosclerosis is a blood clot, so you want to avoid things that cause blood clotting. I've talked about that in other lectures, how to prevent blood clotting, etc. Okay, Caldwell Esselstyn, if you follow a plant-based nutrition program and keep your total cholesterol below 150, your LDL below 80, you cannot deposit fat and cholesterol in your coronary arteries, period. All right, so that's it for today on epidemiology. I hope you found that helpful.